because it's almost night time, I'm going to check on the patients that we have right now. So I'm gonna go into the management mode. Hey guys, welcome to Unmodded Gaming. I'm the Unmodded Gamer, and I'm back with more Project Hospital. And in this episode, we are going to see a surgery, and probably from one of the critical patients that we have right now. We have Elizabeth Hernandez here, who I didn't see before, but apparently she has two hidden symptoms. She has oxygen therapy, she is at the HDU, and they're gonna have to make an urgent echo, although that is not available at the moment. But there's gonna be a whole lot more things that they're gonna do first. So let's hope we can find out what those hidden symptoms are for her. It could be an irregular heartbeat, it could be palpitations, rapid or fluctuating heartbeat, or possibly even both, because she has two hidden symptoms and we don't know how many of them are that bad that she could pass away from it. So we'll make her our favorite patient, and we'll return to Carol White, who should have a neurosurgery on her head, but she is still waiting for the surgical team. We have a skull base fracture. She had a hemorrhage, which is suppressed. She had tachycardia, which is suppressed. We all looked into this in the last episode. She is intubated. She had an open wound on her head, which is helped with a craniotomy, and she had a CSF leak, but that is also helped with the craniotomy. And as we're looking at that patient, I'm going to have a look at the neurology department to see who is ready and if there's going to be a surgery soon, because we have Barbara Davis preparing for a surgery, Daniel Lopez, Fraser Harris, and Linda Thomas. They're all preparing for a surgery. Right, now they're doing it. Performing fracture neurosurgery head, Carol White. And as I now go back to Carol White, we can see that she is actually being taken and brought to the surgery room. So that is good. We're going to save another life today. And let me also have another look at Elizabeth Hernandez, because by now they have figured out she has chest pain, edema, breathing problems, fatigue, dizziness, a wound infection, mitral stenosis, which is the whole reason she came to the hospital in the first place, and fainting. So it looks like she isn't about to collapse anymore, which is good, because that means I can get her back to the computer. And we also have a few things that we need to do for this, for the insurance companies. We need to perform 10 surgeries, treat 30 patients per day at emergency, and we need to treat 60 patients per day. the last one will give us a $5,000 government grant. And the other two will get us 25 patients per day to the clinic. So we can make a lot of money in the future. And it looks like they're performing another surgery right here. Or are they done? I don't know, but we have another critical patients coming in the ambulance, and we'll have a look at that patient. We already have a diagnosis for that patient: gastritis, an inflammation or erosion of the stomach's lining. It is caused by bad nutrition, excessive alcohol use, or excessive use of some medications. Treatment consists of pump inhibitors and discontinuation of alcohol or drugs that cause the symptoms. And she's in a septic shock. I don't know what that is exactly, but I'll give her some IV antibiotics. Maybe a physical examination. And once that all has been dealt with, she can be sent straight to the general surgery department. But that was a pretty easy one, actually. And what is the... Okay. So the thing that they do to treat her is just give her a diet modification. Then I do wonder why she needs to go to the HDU. Maybe because of her septic shock. Well, anyway, that patient wasn't so critical after all. And now we have already almost 60 patients. So we're doing pretty well here. Let's go up one floor and let's have a look at the patients that I have, if any, at emergency. But as you can see, I don't have any patients here. I do have one patient, John Brown, but he is from the general surgery department, who doesn't have a diagnosis yet. He could faint, but it looks like it is pretty difficult to make a diagnosis for this patient. And I could do a microbial sampling, but I don't know if that is gonna reveal anything that is gonna help us. So I'll leave that for now. And I'll also have a look at Christopher Walker over here, who either has lupus, a systematic autoimmune disease that is very difficult to diagnose, because I've played this game before, like I said, and lupus, I know from this game, is a disease that often shows symptoms that are very generic and point to something else, like a fever or a cold, something like that. But this patient could also have giant cell arteritis, which is an inflammation of the arterial lining, mainly in the temporal arteries on the side of the head. They're doing urine analysis testing, and I'm also gonna give that patient an angiography, because if that patient does have giant cell arthritis, that's gonna be pretty important to be found out. We also have a patient being brought to an examination, a CT scan, with pancreatitis. It refers to inflammation of pancreas. It is usually caused by gallstone blockage or excessive alcohol abuse. Malnutrition. A lack of proper nutrition caused by not having enough to eat or eating unvaried. Okay. And the neurosurgery on the head has finished. So for now we'll just leave that patient alone, because there isn't an awful lot we can do for her. We can give her a bandage, and she also has hypotension, which is a low blood pressure, but yeah, it's fine. She isn't in danger, and she won't die. But back to where we were. Christopher Walker again, and it is giant cells arthritis. Here we have that patient again. Yeah, like I said, I'll just leave her, and by the morning she will be out of the ICU, hopefully, and back to the neurology, doing much better. And for now, because it's almost night time, I'm going to check on the patients that we have right now. So I'm gonna go into the management mode, and I'm going to check if everybody has a diagnosis. And well, this is a surprise actually, because we have literally 0 patients at internal medicine. Okay, moving on. We have the orthopedy department. We have someone with an open fracture of ulna, shoulder dislocation, rheumatoid arthritis, a chronic autoimmune disease affecting various joints. It typically results in warm, swollen and painful joints. Pain and stiffness often worsen following rest. And they have, or he gets some medicine for that. And then we have someone who has a deep wound on this hand. I'll have another look at the general surgery department, and this is usually a pretty busy department. As you can see, we don't have an awful lot of space left. We have like 4 empty beds in total at the HDU, and only 1 at the normal or the regular ward. So we'll see if everyone has a diagnosis. Pancreatitis. We have someone with gastritis, unknown hazard. Right, that is Lisa Williams, who came in with the ambulance. Fistula of the intestine. Pancreas confusion. Esophageal varices. I probably messed up that pronunciation, but I don't know what it is. Liver confusion, appendicitis, kidney stones. We have someone again with the same thing as before. abnormally enlarged veins within the esophagus. They are usually caused by portal hypertension due to existing liver disease, bleeding to the stomach, jaundice, vomiting, and then the actual thing itself. And then we have someone with Hus. What is that? Something difficult to pronounce. Hemolytic uremic syndrome refers to the condition when the small blood vessels in the kidneys become damaged and inflamed. In most cases, an infection of Escherichia coli is responsible. Then I'll go up again and have a look at the patient. At cardiology. Myocarditis, IHD with heart failure, mitral stenosis, PAD, peripheral artery disease is caused by a reduced blood flow to the upper or lower limbs due to narrowed arteries, often from atherosclerotic disease. We have someone with a high hazard. So what I'm going to do is I'll mark him as my favorite patient. He also has PAD, he has an irregular heartbeat, hair loss, narrowed arteries and numbness. But it looks like he has his last symptom doesn't or isn't going to kill him or pass out. So I'm going to first get him some beta blockers because that is the most critical thing to do right now, and then I'll have him get cardiovascular surgery. Then we have someone with PAD and angina pectoris. It refers to chest pain caused by insufficient blood flow to the heart muscle. Angina pectoris is often one of the symptoms of coronary artery disease. And last but not least, we also have the patients at neurology, traumatic brain injury, staphylococcal meningitis, CIPD again, cluster headache, and another case of cluster headache. But what is CIPD? Chronic inflammatory demyelinating polyneuropathy is an immune inflammatory disease affecting the peripheral nervous system by destructing the cover sheet that protects and insulates the nerves and fibers. That were a lot of difficult words together. Right. So let's have another look at Frank Harris. We have the night shift coming in, which means that Frank Harris is probably not gonna get any medicine. Oh no, he is. I was about to say he's probably not gonna get any medicine until the night shift arrives, but here he is, getting beta blockers. He's just gonna have to wait for the night shift to arrive to get cardiovascular surgery. But that is about it for this episode, which means that I'm going to say thanks for watching, subscribe for more, and as always, stay unmodded.